Hi class. This is the first video in a series that we will be discussing normal age-related changes in older adults. As we begin this presentation, we will discuss those age-related changes that are noticeable on inspection. Many of these things you have probably already noticed when looking at older adults, but there may be a few that you've never noticed before. It's important as a registered nurse to have a good understanding of what age-related changes are normal and those that may signify disease. At the end of this presentation, you should be able to identify normal age-related changes that occur as we age. In further lectures, we will discuss age-related changes that are not necessarily noticeable on inspection. Here, however, we will discuss those we can see with our own eyes. Probably the most common aging change that we notice is the graying and thinning of hair. These changes may occur in both men and women. It is more likely to see men who are balding, but this may occur in some women as well. In these pictures, we see the graying and thinning of hair in these two individuals. The man in the picture appears to have more thinning than does the woman. Her hair actually appears quite thick for her age. The next thing you may notice, especially in men, is the accumulation of hair in their ears and nose. I would bet that if you ever looked closely at your grandpa, you would notice one of these two things. I have seen men with extremely thick hair filling and coming out of their ears as well as their nose. The only way to control this is to use electric clippers or scissors to keep their hair trimmed. There are actually clippers that have been designed just for this purpose. Here is an example of long gray hairs growing out of this person's ear. Also notice the hair growing around the ears. This is an example of gray hair filling the nose. This doesn't cause any harm, but in some cases is quite noticeable. On a slightly different note, I know an older gentleman who has never trimmed his eyebrows, and his eyebrows actually protrude over the top of his glasses. The next age-related change you may notice is the darkening and wrinkling of the skin around the eyes. I believe this picture shows a good contrast between the young woman on the right and the older woman on the left. There's almost no wrinkling or dark lines around the eyes of the young woman, but it is quite pronounced in the older woman. Probably the best things you can do to prevent this wrinkling is to avoid sun exposure as well as maintain good hydration. However, even with taking these precautions, the skin will normally wrinkle. In addition to the wrinkling and darkening of the skin around the eyes, some older adults will develop baggy eyelids. These can become very pronounced with lack of sleep or in individuals who are not healthy. Notice the very pronounced eyelids in this older gentleman. Also notice the wrinkling and bagginess throughout his entire face. This is an example of very pronounced skin changes occurring on the face. I would expect that this individual is likely not very healthy and has experienced a great deal of sun exposure throughout his life. One age-related change that can be quite dramatic is the enlargement or elongation of the ears. I know two older gentlemen in my life whose ears became extremely large as they aged. You may also notice in some individuals that their nose also becomes very large and pronounced. The actual cause of our seemingly swelling snout and elongated ears is gravity. When we age, the collagen and elastin fibers that make up cartilage begin to break down. This causes them to stretch and sag, making them appear longer. Our skin giving structural support to cartilage also contains collagen and elastin fibers that droop over time. This compounds the lengthening problem. Drooping isn't the only cause to the appearance of larger ears and noses. The surrounding areas of the face, like your cheeks and lips, lose volume over time. The result is the appearance of larger organs next to them. All of this drooping and stretching does cause our ears and noses to lengthen. Studies have shown that ears elongate by 0.22 milliliters per year. This elongation to age ratio is so exacting it can be used by forensic scientists to determine the approximate age of a person. The next thing we will discuss is called arcus senilis. Arcus senilis is an old age syndrome where there is a white, gray, or blue opaque ring in the corneal margin, or white ring in front of the periphery of the iris. Arcus senilis may be present at birth, but then usually goes away. In people under 40 years of age, it may be a sign of elevated blood cholesterol. The main cause of arcus senilis is aging. In fact, it occurs in nearly 100% of men over the age of 80. It occurs due to fat deposits in the outer cornea. It usually does not cause any problems related to eyesight. However, it is a good idea for older adults with arcus senilis to be evaluated by an optometrist or ophthalmologist. As we mentioned previously, older men tend to grow hair in their ears and nose, whereas older women are prone to the growth of facial hair. The problem of facial hair in women generally occurs after menopause and is thought to be due to an imbalance between estrogen and testosterone. Prior to menopause, women have higher levels of estrogen, which inhibits the growth of facial hair. Following menopause, the decreased estrogen, in combination with the continued secretion of testosterone, leads to hair growth on the face. Many of these women will take up shaving in an attempt to keep their facial hair at a minimum. With the decrease of muscle tone and muscle mass in older adults that we will discuss in a few minutes, they will also develop a deepening of the hollows of the axilla as well as the intercostal and supraclavicular spaces. One of the most challenging age-related changes is that of a diminished muscle mass as well as thinning of the skin. I really like this picture because it shows how the body changes in terms of muscle mass and bone structure of an adult male. Notice how once he passes his prime, he begins to lose muscle mass. This can be slowed significantly in older adults who participate in strength training. Here are just a couple of examples of older adults who have been able to maintain much of their muscle mass through diligent strength training. The gym that I go to has multiple older adults who are there doing strength training. It used to be that older adults were simply encouraged to walk in order to stay healthy. Walking is great for the cardiovascular system, but doesn't do much for the musculoskeletal system. It's now recommended that older adults participate in a strength training program in order to maintain their muscle mass. Another age-related change that older adults face is the thinning of their skin. I think of the skin of an older adult like the skin of an onion. It is very thin and tears easily. As you can see in this picture, the skin on this older adult has torn away from simply bumping his wheelchair. Look closely at the skin and you will see that it is translucent and very thin. It is crucial for older adults to do whatever they can to prevent injuries that would lead to skin tears and open wounds. With the decrease of muscle mass also comes a change in the bone structure, which leads to decreased height. The vertebrae actually begin to compress, which leads to a decrease in height. This can be prevented by attempting to maintain muscle mass as well as trying to prevent the development of osteoporosis. We will talk about how to do this later in the course. This picture depicts the difference between normal bone and bone with osteoporosis. Notice in the osteoporotic picture that the bone of the spine has collapsed, leading to a stooped posture and decrease in height. Here is what a person may look like with severe osteoporosis. As you can see, it is impossible for her to straighten her spine and stand up straight. She is also at significant risk for fractures of the spinal column, wrists, hips, pelvis, and lower extremities. Older adults are likely also to experience gait changes as they age. Women tend to develop a narrow gait while walking, and men a wider gait. Notice in this elderly gentleman's widened gait and stooped posture. As you can imagine, this gentleman is at great risk for falling, which could end his ability to care for himself. Over the last few minutes, we've talked about several age-related changes that are visible to the naked eye. Some we have discussed only change the appearance of the individual, whereas others may play a significant role in the health of the individual. Take some time during this semester and try to identify these age-related changes as you come into contact with older adults, either in your families, the community, or the long-term care facilities where you will do your clinical rotation. These are only a few of the age-related changes that occur in older adults. We will cover many more of them over the next couple of weeks.